Okay, so I am here to perform trach suctioning and trach cleaning. So prior to walking into the room, I'm going to make sure I gather my supplies, check my equipment and the expiration dates of the packaging. I'm going to make sure I check for an order to make sure that there's an order for it as well. And then when I get into the room, I'm going to determine the need for it. So I'm going to gather. After gathering my supplies, I'm going to go into the room, knock on the door, open the door, shut the door behind me for some privacy, perform AIDIT, so acknowledge them. Hi Tracy, my name is Stacy. I'm here to perform some trach care for you. I'm going to suction and then I'm going to also clean your inner cannula. Before we begin, I'm going to wash my hands, and while I'm washing my hands, can you tell me your name and date of birth? Okay, Tracy Trach, 11/12/44. All right, and now I just make sure that my equipment is here on my table. I'm gonna now determine the need of the suctioning. So I'll listen, look, and then feel. So I'm gonna listen here for any abnormal breath sounds, any crackling and wheezing. Okay. Take deep breaths and cough while I'm doing that. And after I assess that, I'm going to assess their pain. I'm going to ask Tracy, do you have any pain? If there is pain, I would administer pain meds and then wait a half an hour before starting the rest of our trach care. And if she's not in pain, I would still see if she would need something after we were done before we started the trach care, after the suctioning. So, Tracy, we're just going to suction your trach out today, and we're going to also clean the inner cannula. Suctioning it can just get the mucus that might be lodged or caught in there, making your lungs feel junky. And after that, we'll clean it out because it's going to have a lot of mucus lined into the tubing. So we'll clean that after your cannula after we're done. Tracy, if there is a need for you to stop if you're in respiratory distress or anything like that, I'm going to have you either raise your hand or pat on your leg, whatever you would like. You want to raise your hand? Okay, so her hand's out here just in case she would need to do that. So after moving her bed, I'm going to put her in a semi-Fowler's position. And I'm going to also raise her bed to waist height. And then I'm going to be placing a linen saver pad over her so she doesn't get any of the suctioning on her. Okay, so now I'm going to turn on my suctioning to make sure it works. I'm going to turn it on, and put my gloves on. And if this was a wall suction, we would want to make sure it was 80 to 100 millimeters of mercury. But because it is a portable suction, we want 10 to 15 millimeters of mercury. So now we're going to check the suction and make sure it's working. Alright, and now we're going to place it on her linen saver pad here. I'm going to remove my gloves. After that, perform hand hygiene. Alrighty. And now I'm going to set up my my field here. So I'm also going to put this down so I have room. Okay, so now after I touch that, I'm going to perform hand hygiene again, and because I touched my glasses, I'll perform hand hygiene again. So I'm going to set up this. I was going to, if it was not open, I would open it away from me. I would grab this and place this in the garbage, and open here, and my packaging is correct, so I can just put it here. I would check the packaging to make sure that it was all not expired and not open. So I'm going to place this here. I didn't touch, I only touched the 1-inch board, and not touch inside it or on the outside. So now we're going to check the sterile saline. We're going to, normal saline. We're going to make sure that it's not expired and that the packaging is intact. And now we're going to open and make sure we place our cap like this and pour from a little bit above here. And now we will close it, and I will put it off to the side since I'm done with it. So before performing this, we would put on a PPE. We're going to put on a gown if we suspect it's going to be really messy. And then we're also going to put on a mask here. with a shield. And if it didn't have a shield, we put the mask on and then the goggles. So to put the mask on, we're going to grab from the loopholes here and put it on, pinch the nose, and do each here. And if we had goggles, we put the goggles on over the mask, but because it says a face shield, we're fine. So now I'm actually just going to take this off for the video. I'm going to leave it on my head, just pretend it's still on. So now we're going to open our package here. It's going to have our sterile gloves in it. And we're going to want to put our sterile gloves on. So only touching the 1-inch border, I'm going to grab my sterile gloves out here. And I'm going to put them on. The other gloves don't fit me, so that's why I use these. We're going to just make sure we're not touching anything other than the 1-inch border.
So inside is sterile, so
they're stuck together, so we're going to fix that in a second. And if it was to turn like it did, I would not. I would start over and put new gloves on. Because I have a sterile hand, I could put this here. I'm going to pick up and put on without rolling. And if it did roll, I would restart. So now that this, I just touched non-sterile, but if I did that, I would restart. I'm just going to throw this away here in the garbage. And now my dominant hand is going to be my sterile hand, and my non-dominant hand is going to be my non-sterile hand. So because this is sterile, I can touch here, and I'm going to take the tubing out. And while I'm doing this, I'm going to have my patient start taking deep breaths. This is still sterile, so I can touch this. I'm going to wrap this around my finger here. And my patient's going to start taking deep breaths to make sure that she's hyper-oxygenated and hyperventilated. So now I'm going to take my dominant hand. I have my tube here in the dominant hand. I'm going to take my non-dominant hand and pick up the non-sterile. We're going to connect without touching. And now I'm going to use here to make sure the suctioning is working. And while my patient's taking deep breaths, I'm just going to suction in here just to make sure that my suction's working. Okay, it's working. And I'm going to take this hand, remove the oxygen after they have already hyperventilated. I'm just going to move this down a little bit so my sterile hand does not touch it. So now that I've already have this lubricated and working, I'm going to insert here, no more than 3 inches, just about 3 inches, and I'm going to make sure that my suction is not on while I'm going down. I'm going to leave my finger off of the Y valve. So I'm going to go down about 3 inches. I'm going to tell my patient this might be just a little uncomfortable. So I'm going to intermittent suction on the way out while it's turning. So no more than 10 to 15 seconds. Now I'm going to do this. Hold it here. We're going to hyperventilate her again, make sure she's okay. All right. And we're not going to do this more than 3 times. And then we're going to suction. We're going to clear out the suction again. All right. Now that it's cleared out, we're going to assess the need for another suction, which still sounds like she needs some more suction, so we'll go ahead and do that. So no more than 3 inches again, Tracy. One more time. And turning and intermittent suctioning no more than 10 to 15 seconds.
So I can open
Okay. Tracy, I'm going to have you take a deep breath and cough. Okay, I'm assessing that again. All right. So it sounds like she's doing a little better. So now, since I've already suctioned twice and I don't need to do it more time, we would allow a 30 to 60 second interval in between those two while she's coughing and deep breathing. So now that this is done, now that she's done on the inside of her trach, we're going to go ahead and suction the inside of her mouth. So we're going to intermittent suction here to make sure she just, nothing's in there. Okay, so now we're going to coil with our dominant hand here. We're just going to, and we're going to pull the glove off. over, and then I'm going to remove this, replace the suctioning here, turn off the suctioning, and I'm going to replace it here and here, and then we're just going to throw this away. And then I'm also going to take my mask off, throw that away as well, and then I'm going to perform hand hygiene. And Tracy, is there any need for oral hygiene today? Would you like to brush your teeth or mouthwash? Okay, you do? Then we would just have a basin with mouthwash, and we would give her to brush her teeth. So since I have finished her suctioning, I'm just going to reassess Tracy's need for her trach care. So it did sound a little mucusy, and we're going to make sure that her O2 status is okay before we start this. It needs to be higher than a certain percentage in order for her to be getting all the oxygen that she needs. So Tracy, now what we're going to do is we're going to remove the inner cannula to your trach, and we're just going to not replace it because yours is it's not replaceable, so we're just going to clean it. Unless it absolutely needs to be replaced, then we would have to change the whole trach out. So what I'm going to do is I'm going to put it in peroxide and then clean it, and then we're going to put it in a rinse basin of just normal saline, and then we're going to dry it, and then we're going to replace it back in there, making sure it's dry. And then we're also going to replace the ties around your neck, and we're going to also replace the padding or the gauze that's around your neck as well. So now I would just listen to her again, make sure that she's still good from the suctioning, no abnormal sounds anymore. Okay, and I would have reapplied her oxygen in the beginning because we don't want her to be under-oxygenated. Okay, so now Tracy, I'm just gonna toss this here because I don't need it anymore. Tracy, now that you know our sign, just let me know if you're in any respiratory distress or you're uncomfortable, and we can stop through this as well. Okay. So if my patient was unconscious, I would have them laying in a lateral position facing me, and yeah. So now that I need to do this trach care again, we're going to get another mask, and we're going to pick the mask up. We're going to place it here, one loop, put it on, and since we already suctioned Miss Tracy, we don't need to do it again, but normally we would if we didn't do that already. So that. So here's my trach care cut. I'm going to take this off here. My glasses are fogged up. So here we would make sure my packaging is intact. We would make sure it wasn't open, but it was opened already. We make sure that it was not expired and that there was no holes and that it was in good shape. So now we're going to open it using sterile technique. So I'm going to open it away from me, so here, and I'm going to just take this completely off. And now we are going to take my gloves out here, and I'm going to move this first, and I'm going to make sure that this is only touched by the 1-inch border, and we're going to place it on the table without touching anything, and I'm going to just move it to the spot that I want to move it in. I'm actually going to pull it over here and place my bin like that, and put my my sterile gloves on after I do my hand hygiene. So I'm going to put my sterile gloves on here. And make sure it's not touching my 1-inch border. I know you kind of can't see it, but it's not touching it. So I would make sure I put my glove on the correct way and make sure it didn't roll over my hand.
And then it says grasp the locking as mechanism of the inner cannula.
So, alright, so I'm just going to leave it like this for now. And now I can touch anything on here, so we're just going to put on the dominant glove. And if it rolled, I would restart. And now I'm going to fix my fingers here from the top down. And I'm going to throw this away without crossing my sterile field and just throwing it in the garbage behind me. But I also have garbage in front of me too. So now we're going to place my items from my packaging in, on the fields here. So I have my tie, I have my gauze pads, I have my all of my pipe cleaning and my cleaning supplies and my Q-tips. And now this is our cleaning for our hydrogen and peroxide, and we're going to put this in one of the basins. So I'm just going to put here, pour, and then I'm going to pour, and we're not going to make sure we're not dropping our sterile field. So now that we have poured our peroxide and set up our field here, because I'm going to do it clean, rinse, dry in that manner, so it's going to be a flow. So now I'm going to remove my O2 with my non-dominant hand, and I'm going to remove the inner cannula here. I'm going to put some pressure here so I'm not like taking the whole thing out. I'm just going to turn here without touching anything else, because this is my sterile hand, and I'm going to put it in my cleaning solution. So now that is in my cleaning solution. And now I'm going to remove my dressing and throw that away as well. And now I need to remove my gloves.
I have my area ready, so now I'm going to sterilize the cleaner to take it out.
Now I would perform hand hygiene. And I'm going to not touch my sterile field. I'm going to take my normal saline and I'm going to pour it into my rinse basin. And I'm going to make sure that the palm of my hand was on the label, make sure it's not expired and that it wasn't opened. And I'm going to make sure that this cap is up and not like this, or we want to make sure it's up and you're pouring at a correct angle. I'm going to replace the cap. If not already, I'm going to write the opening, what time I opened it, what date I opened it, and my initials. So now I'm going to put this back to the side since I don't need it.
Sterile gloves. Check the packaging.
So if you had a cuff trach, we would not be using peroxide, but in this case we have peroxide in our kit. So we're going to put the peroxide, that's what we put in our cleaning basin. So now I'm going to put on more sterile gloves. So not turning my back to my field, I'm going to put my gloves on here. And if I needed to, before putting my sterile gloves on, I would reapply oxygen in case we needed that. And I'm going to do hand hygiene. And if she didn't need it, then we would just leave it off until we were ready to replace it. And now we're going to put the sterile gloves on without touching our sterile field. Staying within our 1-inch border. And if my glove were to touch my hand like it just did, I would not. I would be using new gloves. And if it rolled like it did, I would be using new gloves as well. So now I have 2 sterile gloves on. And now it's all sterile, and I'm just going to throw this away, but I'm not dropping below my sterile field. So now I'm going to dip, I'm going to clean my cannula here. So I'm just going to move this towards me a little bit because I have sterile gloves on. So I'm going to take my cleaner here, and just for the video's sake, I'm going to come over here, but I would stay low and I would stay inside the container so I wasn't splashing. I'm going to go inside here and I would make sure everything was coming out. I would scrub it around. I would clean here, and just make sure but I would make sure I was down in the bin. Okay, so now we're going to put it in the rinse basin. So after it's in the rinse basin, your cleaning swab can go back into your cleaning thing. And now we're going to rinse it. We're just going to shake it around a little bit here. We're just going to make sure it's rinsed out, no peroxides on it, and we're going to throw it into the drying rack. So now that that's in the drying,
and I'm going to make sure
during this I'm just going to be talking to my patient, making sure that she's okay and she doesn't need any more oxygen.
I'm removing these gloves now.
Okay, so now we're going to dry the trach. So we're going to grab our 2 pipe cleaners, and we are going to always use the pipe cleaners, never the gauze, because the gauze can cause fibers. So we're going to dry with this, and if it needs to air dry a little bit more, we can. So I think mine's pretty dry, and I'm just going to put those back in there because they are dirty. And I'm going to now take my left hand, it's going to be non-sterile, and hold onto the faceplate and place this back in. And I'm going to lock it in place. So I have a non-sterile hand, and now I have a sterile hand. So I should have probably separated all this stuff before I had a non-sterile hand, but now I can just purse like this and dip into my solution and clean my face. Clean my faceplate, and I'm just going to hold here, make sure that my faceplate, and I would wipe in one direction, inner to outer. I would throw this away. I would dip, and once more time, just in to out, and I would throw it away. Wow. I would not be scratching my nose during this. So now I would pick up my cotton swabs, dip that in the normal saline as well, and clean one at a time. We're just going to go underneath the faceplate and to out. Garbage, and then dip, in to out. And I would start with the side away from me first, so in to out, and then in to out with 2 different applicators. If we needed, we can use more than one, but we would just have to get them since they weren't in our kit. But I don't feel the need. I don't think she needed more than 2 of them, so we can just do that. So after cleaning, we're going to pat dry. We're going to purse like this, and we're going to make sure that we have enough gauze pads to dry. So we're going to dry from, we're going to pat dry, and you're going to get another one, and then you're going to pat dry, and then make sure her skin is clean around it as well. So now that I patted dry, I'm going to put the new dressing on. So this is the new dressing here. You're always going to want to use a drain sponge to make sure this is not sterile. So we're going to make sure that we're using our sterile hand, because this is not sterile, to put on. So we're always going to make sure we use a drain sponge because we don't want to cut our gauze. And now what we're going to do is put it underneath here. And we're just going to want to make sure that we are making sure the patient is comfortable during this. And we're just going to pull it up here. So now that her faceplate, and now you would make sure you're not like tugging on her trach or anything. And now that we have the new dressing on, we're going to remove this from the packaging, which is her new holder. And so now that this is already done, we're just going to remove our sterile gloves, throw those in the garbage, and perform hand hygiene.
My sterile field is pretty much done because I have to apply the
I have a cut on my hand, that's not fun. So now we're going to just perform hand hygiene and speak to the patient, make sure she's okay. If she needs any more oxygen, we would give her oxygen at this time. And at this time of replacing the holder, we're going to see if we need a different person, another person. If we had another person, they would be standing on this side and I would be standing on this side. And we were going to be performing a slip knot. We're going to be doing it one side at a time since we're by ourselves. If we weren't by ourselves, we would be doing
usually or hopefully
we would be doing
two nurses,
my side
on
and
the
her
other
side.
side to help assist. If not, then you'll be doing
So
it
now
by
putting on
yourself.
these gloves here.
So I will untie this side, but at the you have to hold this in because if the patient should cough.
Alright, so now that I have these gloves on after performing hand hygiene, I'm going to just replace her holder here. So this is her new holder,
And then
and so this should just pull off, just like this. And I'm going to hold with one hand and pull off here. And with the new holder, what we're going to do is do another slip knot. We're going to make sure we're not tugging on the trach at all. We're going to perform a slip knot. Okay, it needs to be a little bit longer here.
So I can
So we're going to go under here.
up just a little bit so I can get this behind her neck.
We're going to make sure there's enough room for the slip knot. And I'm going to have my patient, I'm going to undo this side here. Just untie it, not unloosen it, but I'm going to have my patient lift her head up a little bit. Okay. And I'm going to grab on this side, and I'm going to hold her faceplate and remove the other one at the same time. And now performing the second slip knot.
Okay. So
You make sure that you're not pulling.
here's the old
You're going to make sure it's tight enough, but not too tight. You're going to make sure you have one finger underneath the trach here so it's not too tight. But you don't want it too loose because it can shoot out when they're coughing.
this side and I'll check and make sure that I can get at least one finger underneath. I will also make sure that the patient, they can flex their neck.
So now
Make
that
sure
I
this is
have
comfortable. I don't want it too tight
finished with her
because
trach
you'll need
care
to
and her
check for,
suctioning,
skin
I
integrity.
am going to remove my gloves. Reapply oxygen before I remove my gloves, and I'm going to remove my face shield or my goggles. So my face shield's going to come off like this, and I'm just going to place it into the garbage. Now I'm going to reassess my patient's status. So I'm just going to see if my patient were to need anything else, and then also listen to her breath sounds while we're at this, and make sure she's not in any respiratory distress. I'm going to take this with me as well.
I'm going to put the patient
I'm going to listen here, listen to her lungs,
and make sure they have good body alignment.
she sounds
What
good,
they also need to
and
do
feel
is
while she's
reassess their
talking.
lung sounds and make sure that they're
I'm going
okay,
to
it's fine.
make sure that my patient is in a safe, comfortable position. I'm going to make sure the environment's okay before I leave the room. I'm going to ask my patient if they need anything else. Tracy, do you need anything else? I hope that wasn't too uncomfortable for you today. Okay, you're fine. And make sure that she's not in any more pain or any pain than she was. Oh, your pain's at the same level? Good. We did our job correctly then. All right, Tracy, well, you have a good day. I'm going to put you back down here. Here's your call light.
Document this procedure.
Okay, here's your call light. And if you need anything, please press that. I'm going to make sure that her bedside table is cleaned up and back over her. Thank you, Tracy, for letting me do this for you today. I'm going to perform hand hygiene, and when I leave the room, I'm going to document. After I clean up, of course, so I'll just clean up really quick.
Position, make sure they're okay. Pull back the
And put this back over my patient. And take everything out of here. And I'm done. For my 15 seconds, I would make sure I wasn't reaching over my sterile field to get my solution. And I would also make sure that I changed the linen saver pad in between, just in case anything was on them.